It began as a routine heart operation, one the surgical team at Freeman Hospital in Newcastle upon Tyne had performed countless times before. The patient, a 71-year-old woman with progressive valvular heart disease, was admitted in late March 2015 for elective surgery. Her echocardiogram showed severe narrowing and dysfunction of one of her cardiac valves. Despite her age, she was stable, and her prognosis after valve replacement was excellent. On the morning of 26 March 2015, she was taken into Theater 12 under general anesthesia. The surgical plan was straightforward. Replace the diseased valve with a mechanical prosthesis to restore efficient left ventricular outflow and relieve the burden on her heart. The cardiothoracic team made a median sternotomy, opened the pericardium, and placed her on cardiopulmonary bypass. The heart was arrested with cold cardioplegia, and the diseased valve was excised. So far, everything followed protocol. The new prosthetic valve, a carefully engineered device designed to mimic the natural opening and closing of the heart leaflets, was lowered into position. The surgeon began suturing the device into place when one of the sutures snapped. It was a minor setback, the kind of thing that happens in any complex procedure. The valve was removed, handed to the scrub nurse, and prepared for reimplantation. But in the haste of that moment, something went terribly wrong. When the valve was reinserted, its orientation, critical to its function, was reversed. The device was implanted upside down, inverting the flow of blood through the left ventricle. In that configuration, instead of facilitating blood ejection from the ventricle, the valve obstructed it. The surgery continued. Once the patient was weaned from bypass, her heart began to struggle. The left ventricle became distended, ballooning outward under abnormal pressure. The monitors flickered with irregular readings, elevated central venous pressure and unstable arterial waveform. The ventricle wall began to tear under the strain. Surgeons noticed the abnormal function but did not yet realize the cause. They repaired what damage they could and transferred her to intensive care. In the critical care unit, her blood pressure remained dangerously low. Within hours, she developed signs of internal hemorrhage. She was returned to the operating theater for emergency intervention and placed on extracorporeal membrane oxygenation, a form of mechanical life support that oxygenates blood outside the body and returns it, allowing the heart and lungs to rest. Her fingers turned dusky and then black with poor circulation. Despite the extracorporeal membrane oxygenation support, her cardiac function continued to deteriorate. A repeat echocardiogram showed almost no effective ventricular ejection. Only then did the team realize that the prosthetic valve orientation might be the underlying cause. A second operation was attempted to correct the implant, but by then the damage was irreversible. The torn left ventricle could not sustain output. The myocardium, the heart muscle itself, had been fatally injured. She was kept on mechanical support for several days, but she never regained consciousness. She died in the early hours of 2 April 2015, 1 week after the original operation. An inquest later confirmed the cause of death: extensive obstruction and tearing of the left ventricular wall caused by an incorrectly implanted heart valve. The coroner found that the valve had been placed upside down and that the surgical team had failed to recognize and correct the error in time. The hospital, part of Newcastle upon Tyne Hospital's National Health Service Foundation Trust, admitted full liability, acknowledging that the operation had been carried out contrary to the manufacturer's guidance and without adequate verification. The case led to sweeping reviews of surgical safety at the hospital. New protocols were introduced for cardiac procedures, including mandatory device orientation checks, surgical timeouts before closure, and stricter post-operative imaging. But those reforms came too late for the patient whose life had depended on a simple check that never happened. It began as a routine heart operation and ended as one of the most haunting reminders of how a moment's lapse in precision can turn medicine's most advanced promise into tragedy. Like and subscribe to Mr. Neuro Doctor for more.